1, 2, 2, 2. Oh, there we are.
Okay, ydyn ni'n barod. Right, question comes up. First question, please.
When did you start work at the Miners' Hospital?
The Miners' Hospital, when did I start? Yeah. Well, I qualified, passed my medical exams in July 1966. And I started work here in August 1966. Does anybody know how long ago that is? Come on, use your maths.
52 years?
50,
2?
bit more.
53? 56?
Yeah.
Close.
Count them on your fingers if you want to. It'll be 57 years in August.
Well, you were all nearly there.
57 years in August, okay?
Lovely. Okay, Tyleri, question nesa.
How many hours did you work each day?
I can't remember because we were working all the time, mostly. I lived in the hospital and we had Monday evening and Wednesday evening off, and every other weekend, Saturday and Sunday. But the rest of the time I was on call. So I was in the hospital and we worked when we were needed, which was most of the time. So we were called out in the night and all sorts of things. Okay?
There wasn't much time when you weren't in the hospital.
No, we lived here, and as I say, some of the doctors were married, and they had flats over at the end of St Martin's Road, right near the hospital. But the ones that weren't married at that time lived in the hospital.
Okay,
How
next
long did you
question.
work here?
I worked here for a year to start with, and then I came back and worked another 6 months. So I was here 18 months altogether.
Can you tell us what you did here and was it hard work?
Yes, it was always hard work because you were always tired. This was the big problem. When I came first, I was a junior house surgeon. So I worked on the surgical unit. And after 6 months, I moved on to the medical unit. Then I went away to Wrexham. I was away to Wrexham for a while. And then I came back here and I worked on the maternity unit. Okay? So I was more senior when I worked on the maternity unit. Okay. So, as I say, the work was busy all the time because it was always, because we covered casualty in the nights as well, what they call A&E nowadays. We used to call it casualty.
Okay, right, question 5, please.
Did you enjoy working at the Miners?
I loved working at the Miners. It was,
Was it a good hospital?
yeah, we had a full general hospital when I worked here. Was that right, Pat? Yeah. And we had medical emergency intakes in medicine, surgery, maternity, orthopedics. So, you know, it was a busy hospital then. Because obviously, I don't know if you remember, I don't think you'd be old enough, but the hospital was they had new buildings all the way joined onto it. So though this was the original hospital, they had built on a lot of new buildings, so there were other wards and other departments.
Yeah, we used to ask our ambassadors how many of you were born in this hospital, but we can't ask that anymore. They're too young.
Yeah.
Too young now. The last generation to be born here,
Yeah.
older than you are. Yeah, we are
Right,
right.
okay.
Question 6. What's next?
What did you wear?
What did I wear? Now that's changed a bit. We never wore scrubs. You see them all running around in scrubs these days. When I came on the ward to do a ward round, I had my collar and tie, and trousers, of course, and a white coat, which went down to below my knees. That was a doctor's coat, doctor's outfit. Yeah.
Yeah, so if you think of, even if you haven't seen doctors in hospitals in real life, if you think of all the TV series about hospitals and what they wear now as in casual.
But we only wore scrubs when we went into theatre to operate.
And he didn't walk around with his stethoscope dangling around his neck.
No, well, not like that. I brought my stethoscope to demonstrate, right? You see them now on casualty and all those sort of things. They all walk around with a stethoscope like that. You see?
He didn't do that.
Yeah. Now, when I came here first, the stethoscope had 2 tubes.
That's right.
Came down here, so they wouldn't go round your neck. So we always wore them like that, and put them into a white coat. Okay? So that's a big difference, isn't it? But now they brought these fancy modern ones with one tube. They won't put them around their neck. It's their badge of office, okay? So sometimes they were stuffed in our pocket. So it was, that's changed a lot. Some of the medical equipment has changed a lot as well.
We've got a question about
We've got a
that.
question on that, yeah.
Anyway, what's the next question, please?
What was the food like?
The food, well, we were very lucky. Because when I came here, the doctors had their own dining room. And we had ladies who cooked for us. And they were Welsh ladies who cooked Welsh food. Yeah, and they used to bring in stuff from the garden in the summer. So we ate very well. But I learned how to eat very quickly. Because you sat down to a meal and your bleat would go and you'd have to go somewhere. But the food was great.
Lovely, carry on then.
Was the salary good?
Was the
salary good?
The salary, you know what, they're all on strike now and grumbling about it, yeah. Well, it's no different from then, because when I started, I earned £770 a year. And out of that, I had to pay £30 a month for board and lodge in the hospital. So I was left with probably about £25 a month, something like that. So they've never actually paid the doctors for the number of hours they've worked. But that was our job, and that's what we accepted. But, things have changed. So there we are.
Did you make friends at the miners?
Friends at the miners, lots is 1 year. Yeah, everybody was a friend in the miners. I knew everybody from the boilerman who operated the heating systems up to matron and the hospital secretary.
That's right.
Yeah, and we talked to everybody, we knew everybody, the ward orderlies. And, it was a huge, it was quite a big staff.
It was.
And we knew everybody and all the different shift nurses and that sort of thing.
Lovely, thank you. Right. Question 10.
Were you ever injured at work?
No. I did get jabbed a couple of times with a needle, but not. I wouldn't have called that an injury in those days. They do these days.
Get on with it.
Okay.
All I was tired. That's what I can remember it.
I'm sure. Right. Question 11. Antonio? Yeah.
Was your equipment good compared to today?
It was very different. Very different. The ward equipment was different. We had, you see the drip bottles they put up, the drip bags.
Oh yeah.
Yeah, they were glass. They were always glass. The injection needles and were always glass. They were glass and metal. They weren't plastic like they are now. So, and they used to use needles which were sharpened and sterilized every time they were used. So now everything's thrown away. So in those days, we learned to do
We were
it.
environmentally friendly, David.
We were very environmentally friendly. We don't realise how much we were at that time. We didn't have scans. We didn't have any fancy PET scans and ultrasound. I think ultrasound was coming in.
And
Just started. Yeah, just started. But it was mostly X-rays if we wanted further, and we also could do blood tests. And we had quite a good range of blood tests. But the equipment we used looked different. As I said, the stethoscopes, even my stethoscope had 2 tubes. It was and a pointy, like a conical thing on the end to listen through. So, things have changed.
What was the best thing about working here and why?
It's difficult to answer that, mainly because for example, on the surgical unit, we had 2 doctors who were then what they called junior doctors, just qualified, And I hate it on the news when they talk about the junior doctors, because junior doctors are the ones that have just qualified. But a junior doctor is classed as a junior doctor right the way through their working life till they become a consultant, which could be 15 years. And, you know, this is why the hospital depends on them so much. And they're not junior, they're fully qualified doctors. But the nice thing about it was we had two doctors working to the consultants, 2 junior doctors, and we had what we call a senior house officer, who was a doctor who had worked a couple of years, longer than us. And on the surgical ward, we were the only ones that were immediately available, because the consultants and the registrars, who were the senior doctors, lived in Cardiff. So a lot of the stuff, a lot of the emergency we had to deal with, which gave me a huge amount of experience, because things happen quickly sometimes, and when you've got to call somebody from Cardiff, you really can't wait for them to come. You've got to get on with it. So I got an awful lot of experience working here, because you had to learn quickly how to do things, and different operations, and do blood transfusions and all sorts of things. So that was the best part of it, was from a learning point of view.
Okay, right, so an interesting question coming up, I think.
What was the worst event you can remember while working at the hospital?
It was the day I didn't have much work to do. The 23rd of October 1966. We doctors were called into the office, all of us, and told that emergency services had been installed, and we were to be prepared to take a large number of casualties. And we had to send home patients who were near enough going home. We had to stop doing blood tests. We had to stop using blood unless it was life-threatening. And we sat there all day waiting for all these emergencies, and none of them came. And anybody know what that thing was?
Does that date suggest anything to any of you?
What was
The 23rd of October, 1966. You're all far too young to really remember it. The Aberfan disaster.
Yes, I'm sure you've heard of it, you know, when the cold came down on the school and a lot of children tragically died. So
and basically the surrounding hospitals had all been put on emergency alert, and we suddenly found that there were very few casualties. It's got to be the worst day of my life.
So we've got a question.
I think in that when I was there, my great granddad was a man of Blackbirds, and he was one of the first ones to help.
Yeah. Oh, people came from all over to help, yeah. And the annoying thing was, we wanted to go up to help, but we weren't allowed to, because they wanted us to stay here in case they had a lot of casualties coming in. But as I say, most of them are dealt with in the old Merthyr Hospital that were there.
But of course, so many people have died. You know, there were possibly fewer casualties.
Yeah, that's right. So, that was the worst, because of the memory of it, yeah.
Right, we've got one final question. So remember, you're talking to Dr. Jenkins, so your question's going to change a little bit for Mrs. Newton.
Is the doctor's working life different today to what it was when he worked here?
The working life. I don't think there's a huge difference. I mean, they work long hours now. The trouble is, of course, when you can't say you're going to work at 9 o'clock and come home at 5, because if you're dealing with a serious patient, a serious casualty, or somebody who's seriously ill, you can't just up and go home. You really got to stay, and certainly in a hospital like this, you covered it until you sorted out what you needed to do. And I think that's very much the same these days. there's a different way they work nowadays because they work to different a different system. We always work to a specific consultant, whereas they can work to several wards, and they can be under different doctors looking after different patients. So there is a difference with that, but they still get tired because, as I say, they're very often not going home until 10 o'clock at night, and then they get back out by 8 o'clock in the morning. So not much difference.
Lovely, that's great. Thank you
Do
very
they want to know a
much.
funny story?
I'm sure they do.
Yeah. I don't know. Think a funny story just to lighten it a little bit, if you've got time. When I was working on the medical ward, it was called Nelson Ward, we had a gentleman came in. He had been a boxer. And you know all this story about rugby players getting brain damage? Well, boxers used to get it. They've always had it. And this chap had started to get some trouble from brain damage. And he had extremely high blood pressure. And he came in because he had gone all confused and he was, he was really not with it at all. So we had him in and we were treating the blood pressure, trying to get him calmed down and various things. And by the morning we thought he was better. But he got up out of bed and he had his hospital shirt on, back to front. So he was all naked at the back. Okay? And he was prancing around the ward, being really bolshy. So the ward sister said, we need to send for one of the porters to help restrain him. And they sent up little Reg.
Oh, God.
He was 5'2" and about 7 stone. And this chap was a sort of cruiserweight boxer. So we just fell about laughing. We thought he was going to, little Reg, if he went anywhere near, he'd be flattened. But the poor old patient got frightened and jumped out of the window in Nelson Ward, which is a ground floor, and ran off down the road. And I ran off after him in my white coat. And we were going down past where is the moat house now, with him running with his half-dressed and me running in my white coat till I caught him. And managed to calm him down and brought him back.